You are listening to the Mom to Mom podcast, hosted by Stephanie Sinclair, founder and owner of How to Mom. This podcast is meant to empower women and bring the community together through storytelling and education. During these episodes, you will hear stories of triumph, heartache, and hope. You will hear time-tested tips and tricks shared by mamas and women. You will hear a variety of birth stories that will resonate with all birthing families, advice from professionals who have dedicated their teachings to pregnancy, birth, and moms. Here, you will find encouragement, support, and community, because we are your community, and we are so happy to have you. Now, on to today's episode. Hello to our Mom to Mom listeners. Thank you so much for joining this episode. I have an amazing guest today who happens to be a Twin Cities professional, and I cannot wait for you guys to hear from her. Her name is Amelia, and she is the owner of Bellflower Lactation. She is also a mother to 3 amazing girls. She has a singleton and 1 set of twins. Her and I have a lot in common. She is a board-certified pediatric nurse practitioner and an IBCLC. In 2007, Amelia graduated from Boston University with a Master's of Public Health in International and Maternal and Child Health. She then went on to get her Master's of Science in Nursing from Yale University in 2010. And then she became an international board-certified lactation consultant in 2016. She has worked with parents and babies for many years, but her passion for breastfeeding truly began with the birth of her first daughter. She found breastfeeding her singleton baby and then her twins to be one of the most challenging and rewarding experiences of her parenting journey thus far. Her own experiences inspired her to further develop clinical skills to allow her to better help families by providing evidence-based lactation care. She understands the critical role feeding plays in a child's first year of life and the impact that experience can have on our entry into parenthood. She is uniquely suited to identify and diagnose tethered oral tissues while crafting an individualized care plan for your family. She has completed more than 75 hours of continuing education in tethered oral tissues and has developed close working relationships with many experts in the field to maximize care and outcomes for your family. Bellflower Lactation provides evidence-based, family-focused lactation care here in the Twin Cities. We are so lucky. The Bellflower signifies unwavering love, representing not only the way we feel about our babies, but also the steadfast compassion she believes all parents deserve on their personal breastfeeding journeys. Amelia, thank you so much for being here today. What a comprehensive, amazing introduction to all that you do and all the knowledge that you are able to provide to families here in the Twin Cities. Welcome to the podcast.
Thanks so much for having me. I'm excited to be here. And that's a lovely introduction. I wish you could follow me around all day and just...
Oh my God, I would love to do that.
It would really raise my self-esteem.
I would absolutely love to do that. I think not only with your background professionally, but what I really love is your background personally, really being able to relate to families, not only families with singletons, but also families with multiples who kind of have a whole host of other scenarios that they need support in through their breastfeeding journey. So I think that really relates with other moms who are listening today, that you too experienced some of these maybe hurdles, some of these issues with your breastfeeding journey, and that you truly believe that support can make all the difference regardless of what your plan is for your breastfeeding journey. So I would love for you to take us back all those years ago with all that beautiful education, and even talk to us a little bit more about kind of the mission behind Bellflower, which, by the way, I love the meaning. That is so beautiful. How did you come to that, and how did you really visualize what this professional career that you have today would look like, and why that was so important to you?
Good question. You know, I kind of came to this on this whole path in a roundabout way, in a sense. I really thought initially that I wanted to work in international health and like work with mothers and babies in refugee camps or that type of path. And I had done some of that work in graduate school. And then I realized when I was doing that, that what I really wanted to be able to do was like the hands-on care, that sitting behind a computer was less interesting to me. I wanted to be able to take care of patients hands-on. So I actually started nursing school on the nurse midwifery tract.
Oh, you did?
I did. Yeah.
I didn't know that.
Yeah. And I really, and I still like, you know, if I could do everything, sure, I would do that too.
Of course.
But I realized pretty quickly into nursing school, nurse practitioner school, that what I really loved most was the dyad. So the mom and baby dyad. And you get that with midwifery, but what really interested me more was that postpartum journey. And so I switched to pediatrics because I thought that that would introduce a bit more actually an opportunity to do that, just with how kind of modern midwifery has evolved. Right. And so I switched to pediatrics and worked in primary care pediatrics for many years and enjoyed that, but really always felt that we were missing this. You know, when before I was a mom, if people would come into the office and I would see them for their well child visits, I'd say, okay, how's feeding going? Great. And we would move on. And I just, because I hadn't had that journey myself yet as a mom, like I thought I was doing a good job. Right. And
well, you just don't even really realize how like in depth it is, or how big of a journey, or how big that is a part of your motherhood process. Yeah,
absolutely. I mean, if I could go back and like redo it, I would with such a different approach now. But and then my oldest daughter was born, and we actually had like a relatively good breastfeeding journey, all things considered.
Yeah.
But it changed so much of how I understood that feeding factored into the whole family's like experience of, you know, and no matter what type of feeding, but those choices around feeding and all of that, I always say blood, sweat, and tears and thought processing and all of that that goes into like, how are we going to feed our baby? I really started to understand the power behind that. And so that's then when I decided to start on the IBCLC path. And then I became an IBCLC, and then shortly thereafter got pregnant with the twins. And I thought, okay, universe, you continue to humble me.
Showing me. That's what I say. I say motherhood not only humbles you, but then after Mackenzie, my singleton, I felt like even with all of the complexity around becoming a mom and the feeding journey, I was like, okay, I feel like I kind of have a grasp now. Like I kind of got this motherhood, not thing figured out, but I felt more confident. I felt obviously more confident in birth after becoming a doula. And then I was like, okay, let's just humble a little bit more. Like now I know nothing again.
Yes. And you know, I mean, like full disclosure, right? The first year of having like the twins and just being a mom of 3 little kids, right? As you know, it's just, at least for me, it was just like keeping my head above water all the time. It was a 100%. Really difficult year. But I'm so grateful. I mean, obviously for my amazing children, but I'm also grateful because of how that's allowed me to show up for families now in a really different way. So it's no longer like, okay, how's feeding going? Great. But it's just so much more like, how are you, mom and dad? Like, what is happening, right? How is the whole family structure just operating? I always
and not just like, I can't imagine what you're going through, but like, I've been there. And I felt like the first time you and I met, which was not for a lactation visit, but rather just to meet, I feel like you said that to me when you found out that I had a singleton and twins. You were like, how are you doing? And I was like, she gets it. Like, she gets it.
It's hard, right?
So hard.
It was not a graceful, easy moment of life by any means, but
be able to touch base with those families.
Yeah. Yeah. I feel like it definitely has given me such a deeper sense of compassion.
So true.
And I love being a pediatric nurse practitioner because I have all these awesome, like this whole awesome background I'm very happy with on caring for babies and children, and that just has given me a good sense of child development and all of that. However, I also love the fact as an IBCLC, I have the breastfeeding parent and the baby, right? However, I always say I have the whole family, because really it's not just, because if you have older children at home, or you have multiples, or your partner's not doing well, like that influences how I feel I should help guide your feeding experience. I always felt that when my twins were born, I struggled a lot with breastfeeding with them, and I had a very difficult journey that did not maximize my mental health in a positive way. But I just didn't feel like anybody really understood that I had 2 infants and a 3-year-old, and actually a partner who was not in a really good mental space at the time. He was sort of dealing with his own depression, and it was just like, it was very much a year of survival. And if I had had somebody who was able to kind of really tune into that, and if I had let myself be vulnerable enough to let that happen, right, I think it could have been a really different experience for everybody. So I try, my goal is to try really hard to see the whole family, and what does the whole family need, because it's not just about breastfeeding, right? It's about so much more.
And I love that approach. Like, it kind of reminds me of like total wellness, right? You hear a lot of people talk about wellness, and it's like, you can't just focus on one factor when you're talking about total wellness. And I think why we have always really related with one another, not only personally, obviously through our journeys, but professionally, is both you and I know the positive effects of breast milk, and we know the nourishment, and we know kind of the science behind it. And all of that is important. Absolutely. Just like the education we do in birth, families deserve to know all of the information. But with your approach as an IBCLC, what I love is that you do take the entire family unit and you say, how can we best maximize this journey, everyone's mental health? Because it does matter if you have older kids. You cannot be on the couch all day long triple feeding. Like, that's not sustainable, I think, regardless. But I also think when we are considering the different factors, the family dynamics, the mental health of the parents, like, I love that so much. And I always say here, not only as a lactation counselor, but as a birth doula and just as a mom, is pro breastfeeding does not equal anti-formula. And that kind of is a whole nother conversation, but I just really want people to hear from you right now about this, because I think it's so important. You obviously have a passion for breastfeeding, for maternal health, for pediatrics, but we can take all of those things and we can sit down and have an individualized plan with each family, because each family matters and their journey matters. And I just love that about you. And I think that's so important. And I think a lot of times that can be missing, because like you said, to sit down and go, oh, well, this is the feeding plan for your twins. Is that realistic with my daughter, with my husband, with my state? Like, all of that matters.
Yeah, I mean, I think now, the twins are 6, so like I finally feel like I'm moving out of like postpartum, which might sound ridiculous to some people, but
no.
Yeah, I imagine you can relate, right? Which I think has allowed me to really reflect on my own experience, right? I have a different perspective now, and to be able to show up for these families in a different way, maybe even than I could have a couple of years ago, right?
Yeah.
But I do think that above all else, and I really firmly believe this, we need to focus on mental health. And yes, feeding is important. However, if we're, my own journey, right? I triple fed the twins for 9 months, and I was in such a desperately anxious, depressed state, but I was so focused on the feeding side of it that I was not able to show up for my family now in the way that at that time, in the way that I would have liked to. And I look back with so much regret. And I just think, like, no, my mental health should have come first. And if that would have happened, the whole story would have been different, right? And so I think even increasingly, like really recognizing that side of it. And, I don't know where that will take my practice, like what that means in terms of like future Bellflower and how that evolves to be determined still. But I'm increasingly feeling like so much passion about that side of it.
Yeah.
And I love the part about what I do, which is not just plopping breastfeeding plans on everybody who walks in the door, like, oh, here's plan A, there you go, and out the door. It's really what's going on for your whole unit.
Yeah.
And within that now, what do we do? And it's so unique and it's so individualized, which it keeps my job very interesting as well.
Absolutely. No two patients essentially are the same. But I think what's beautiful is you can do both, right? Like if a mom is having a successful journey, but maybe there's just some hurdles that she needs help with or baby needs help with, that's what's so great is, having that individual hands-on care to say, here's kind of what's happening. Here's what I'm experiencing. Let's do a feed. Let's see, like you can do all of that still. And that's such a beautiful support system as an IBCLC. But what's that relief part, I feel like, is if I sat down in your space with my twins and you said, how are you doing? And I say, this is important to me, but I need relief here. The fact that not only would you recognize that, you would validate that, and you would say, okay, we're going to make a plan that works for you. Like, I feel like so many moms probably get to breathe for the first time when they sit down with you. Like, to me, that makes me want to cry. Like,
yeah,
to just feel validated and to feel heard, and also like to be given permission that like, it's okay if we need to detour here a little bit, or if we need to, come up with a plan together that makes you feel good, your baby feel good, your family feel good. Like, wow, I am sure so many moms just literally can take the first breath and go, I feel so happy that I have a plan and I don't feel judged. Oh,
yeah. I think that's huge. And unfortunately, there's tons of amazing lactation providers out there. Don't get me wrong, but I've heard from a lot of families about some really negative experiences, and I hate it because it reflects poorly on all of us, but I also just think that there's no need for it. If we really kind of go back to why are we in this work, it's to support families. It's to get them through a really difficult time, and a time that influences all the years to come, right? Like how we start out in parenting influences, what kind of parent we evolve into and who our children become. That's not to scare people, right?
Oh.
Like it is a hard years potentially, but I feel like if we really, as lactation providers, if we could maybe let some of the ego go, if we could let some of the like dogmatic approach go and be a little bit more willing to just like hold space. And it's, it's one of the reasons like I love having my own practice is because I'm not necessarily bound by some of the restrictions of a hospital space or whatever, right? I can have longer visits. I can be flexible on follow-up. Like we have a lot more opportunity when we're working independentally.
Yeah,
I text a lot with my patients. So like just being able to sort of, especially if we've had like a difficult visit that I knew was emotional, maybe a day later, a couple days later, being able to text somebody and just like, hey, how are you doing? Like that was maybe a difficult visit. How are you holding up now? Or where do things stand? So yeah, I really love that freedom in having my own practice.
Yeah, it's so directly related to the overall experience, and your emotions and your hormones are a part of your breastfeeding journey. Like, and to deny that would be really, really naive. So I am really interested. I want to hear a little bit more about the Bellflower and how you came to that and how that is a part of your life to kind of influence not only the name, but just the meaning behind the practice too. I love hearing these stories.
Oh gosh. Well, I'm worried you'll be disappointed. I don't know.
No,
starting the practice, right? I'd always had this dream of like having my own lactation business. And my husband was very much like all in. He was like, yeah, let's do this. And he was a huge supporter, which was great because it's risky, right? Scary.
Very.
So there was just a lot of brainstorming of ideas, just like going out there. And I was sort of like, I like a flower, but I got to find the right flower, right? And then I happened to come across that. And I was like, oh, that's such a beautiful image, right? Of just like compassion and patient love, right? That's what we all need. Our babies need it, but we need it as parents too. So it just sort of, it struck a chord with me. And and the rest is history, I guess.
The meaning behind it. And I think too, it's a pretty, unless, I mean, I'm definitely not into flowers and gardening as much as I would like to admit.
Terrible gardener.
But to me, it's a unique flower name. It's not one that you hear. And so I think it's just really fitting. And I just love the meaning behind it. It definitely aligns with your practice and just who you are as a person. So I think it's perfect. And I always love to hear those stories. So let's talk a little bit about your specific services. So how do most people get in touch with you? Kind of what's the process to get on your books? And then what do those appointments look like in your office, in your space? All right, you guys, we are going to take a brief break from today's episode so I can tell you all about one of my favorite companies, Kindred Bravely. They design and sell the best pregnancy and postpartum bras, underwear, sleep, and loungewear. They also have one of my favorite products. It's called the 4th Trimester Panty. This product is just wonderful because it supplies some security for your postpartum belly. And I really needed that when I was postpartum. But it also is designed and comes with some cooling pads. You can either put them in the freezer to add a little cool touch, or you can put them in the microwave to add some heat, whether you're recovering from a surgical or a vaginal birth. I literally wish I would have had this in my postpartum days, especially when I was recovering from both a vaginal and a surgical birth with my twins. One of my favorite products from them. But please feel free to go to their website, check out all of the amazing products that they offer. You can get to their site by following howtomom.com/links. Follow the Kindred Bravely link. And then at the end of shopping, you can add the promo code HowToMom15 to receive 15% off today. All right, now back to today's episode.
Yeah, so I offer prenatal visits and kind of in two forms. One is just like a quick meet and greet over Zoom usually. And really just sort of like, do we jive? You know, like some basic questions, not really anything. At that visit, we don't go into any medical detail or anything, but just basically, you know, do we fit? Are we a good fit?
Is it a good
basic
fit?
Questions about the logistics. And then the other type of prenatal visit I offer is more educational. So if this tends to be more families who have had older children, it hasn't gone well, and they have a lot of anxiety or concerns kind of about next baby coming. So that tends to be more focused. And usually it's more like an hour-long education session where we like really dive into what their concerns are. And then once babies are born, and certainly most people do not do prenatal visits. I would love to get more people to do it.
I was just going to say, I love that. I had no idea that you offered that. And that is so great for me to know, to be able to let our clients, I mean, and especially I think what you said, even more so, maybe a second, third time mom who has not had great experiences in the past, and they're kind of going into their birth with that worry and with that concern. Like, I feel like that would be such a beautiful opportunity to not only like let them know you have support and this is the support that's available, but then kind of offer some other options or ideas to say like, this can look differently and it can be a really healing and empowering. So I love that. I know that.
Yay, good. Yeah, no, I mean, I wish people did more prenatal visits because I think, as you know, we prep a lot for how's the nursery going to look and what's all this stuff, but then we sort of maybe don't do that other work. And then most people though reach out to me after babies have been born. And some people just are like, I think things are going okay, but I just want to check in. And of course those tend to be fun visits because it's a lot of like reassurance and just education. However, a lot of people reach out to me, and I have a lot of visits where it's, you know, I've seen 3 other lactation consultants. I'm still having trouble you're my last ditch effort. And that's not to say like hero swooping in, but you know, typically because I am also the nurse practitioner, I have a lot of advanced clinical skills. And so hopefully I can help in those scenarios. And then I offer virtual visits, I offer in-office visits and in-home visits. And it really depends on sort of what people are looking for and what my schedule looks like at the time.
Mm-hmm.
Most people come to my office, which is right in St. Paul, kind of centrally located.
Mm-hmm.
But I certainly do some home visits, and some people just prefer virtual. They're like, I just, you know, and those tend to be a bit more education based, but it's actually surprising how much we can accomplish in a virtual visit.
I agree.
Yeah, it always, I think, surprises everybody.
Yeah.
And then really it depends on what's going on in terms of follow-up. You know, once in a while, if baby losing weight or we have concerns, it'll be a closer follow-up. And then other times it may be, hey, let's shoot me a message in a couple days. Let me know how things are going. We'll figure out follow-up then.
Yeah.
Or it's much more kind of specific. Hey, let's see each other in a week and then we'll go from there.
Yeah.
So it's really individualized. Some people I see once. There's plenty of families, or they just kind of come in for that one visit. And then, you know, I've worked with other families 9-10 times. It just depends on what each family needs.
Well, I was going to say too, sometimes I'm sure with the virtual visits, not only educational, but sometimes just like logistics for their individualized care of like, not only reassurance of like, is this normal? Like, is this what I should be looking for? And like that reassurance and that education, but then also like, this is my setup at home, or here's my schedule, or here's something that came up that might be interfering or, you know, posing more questions. And so I feel like not only is education such a big part of their breastfeeding journey, but sometimes it's just like the logistics of, hey, I want to sit down with a professional who knows. And I think too, what can be so beneficial when we seek support from experts and providers is, and it's not this like hero thing, and it's not necessarily, it's not even that there's like one way, but sometimes, especially as a really tired mom who's trying to just keep her head above water, kind of see through the clouds, you know, because a lot of times I get questions relating to birth, like, well, you're a birth doula. Did you have a birth doula? Did you have lactation? Yes, 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 and yes. Like as a mom, sometimes there are just things that you can't connect the dots, or like you just can't see correctly. And it's just that support is so important. And so I can see how those virtual visits could be really beneficial. But then kind of leading into the at-home visits, whether it's at their home or in office, I think too, sometimes even just minor adjustments in positioning. I was like, holy buckets, when I went and saw an IBCLC with the twins, it was like these little tweaks that I'm like, that was so beneficial. Like it was mind blowing. And I felt like I had kind of a hand up compared to a lot of families just being in this world. And then just like, I guess what I'm trying to get at is like, not that there's one way, but to get an answer. A lot of times I feel like maybe in lactation, and maybe why some of these parents are coming to you and saying like, this is our last ditch effort, is like, they need to know a plan. And that doesn't mean that there's only one way, but that there's not like, well, you could try this or you could do this. And then they're leaving maybe even more confused than when they came. And what I love about your practice is that's not the approach. They are leaving with a concrete plan and some potential answers, which I'm sure is a huge part of their relief.
Well, I mean, same thing. Like I had doulas, I had lactation help with all my kids. Cause you're right. When you're so sleep deprived and you're so hormonal and you're so in it, you can't, you know, you just can't step out and see it objectively. But yeah, I feel, and I love a plan. Just ask my husband.
Me too. Yeah.
But I
for these individuals in this world.
We do exist. But I think it's really empowering when you're feeling so in the woods and so disoriented, because that's a lot of what this is in the beginning, right? It's to have somebody say, okay, let's try this. And I always tell people like, plans can change, right? Go home, try this for a couple days or try this for a week. And if it's not suiting you for whatever reason,
Yeah.
we'll change it, right?
Yeah.
Nothing has to be set in stone. And it can be beautifully fluid, right?
Yeah.
But I think you're right in the sense that like just being able to leave the office and say, oh, okay, this is what my day is going to look like. And here's the goals I'm going to shoot for, tends to sort of people go, oh, okay, all right, I can do that. I can do that for a week, right?
And I guess I should say, instead of like an answer, more so a direction.
Mm-hmm.
Like you are giving them direction, which is such a relief, because not only are most people that come to see you not experts in lactation, but they don't know what to do, and they need somebody to say, here's the direction we're going to try. And I love that. Like, we can change it. It doesn't have to stay that way, but like, here's a direction. So they're not leaving going, well, now I don't know what to do. Like, now I feel more confused than when I walked in the door. So I think that's really beautiful. I would love to lead into, because I feel like ties are such an important topic. I would love to kind of chat about that, but I had a random question. Do you ever hear from potential clients before their mature milk comes in? And what's your approach if you do?
Yeah, good question. I mean, yes, but not usually as often.
Mm-hmm.
So a lot of times in that scenario, it's actually people I've seen for prenatal visits.
Right.
And then they'll reach out like the day baby's been born.
Yeah.
And, you know, and I always say, like, I'm happy to help you as soon as you feel you need help.
Yes.
But, you know, hopefully, and especially if you have a doula or you at least have a lactation savvy provider, right? A midwife or an OB or a pediatrician, somebody who knows at least something, right?
Yeah.
I always tell parents, like, the first couple days, you know, the basics are the basics. It's skin to skin, it's frequent offering. We don't have to overcomplicate it. And I would rather not overcomplicate feeding unless we really have to. It's overwhelming enough, right? So I think really always trying to just lay the foundation in the first few days or week is the most important. Doesn't mean I won't see people in that time.
Right.
I certainly think most people, I mean, I get people, I would say most of my clients who walk in the door, babies are anywhere from anywhere from newborn, right?
Yep.
But really, I would say mostly probably 2 weeks to 4 or 5 months.
Yeah.
Right. So like, there's a big age range. And I do have some people who I just saw not that long ago. It was like an 11-month-old for the first time. And I was like, great, like, this is fun and exciting. Right. But I think that I'm not typically seeing them in those first couple of weeks, not because I don't want to, but because there's so many other awesome providers who are quite capable of managing that.
Absolutely.
In a generally unexciting feeding picture, right? When things are basically going as planned.
Yeah. And just like you said, encouraging skin to skin and encouraging healing and rest and connecting and sleeping when you can sleep. And that would be my hope too, is that most have that person they can reach out to really kind of not complicate things right off the bat, right? Because there's already so much happening to like, and sometimes that's even a little bit of advice that we give to our clients is, we don't want that obsession right after we give birth of like worrying and weighing and overthinking, but rather connecting, stimulating, letting our hormones get to work. So that was just an interesting question. And I just noticed the difference too, as a lactation counselor, and why I love our postpartum visits in home, you know, usually around that time frame where their mature milk is coming in, because so much can change when that occurs too. And so it's really beautiful that we get to see them right after baby is born, encourage, support that skin to skin, help them with some different holds so that they feel more confident and comfortable, little tips, but then being able to go into the home when that mature milk is coming. And then we're able, within our scope, to let them know and encourage them if we think that additional support is needed from an IBCLC. And that's what I love, you know, with the work that we get to do in this community, when we get to network and collaborate with other providers. to me, I just want all of our clients to not feel overwhelmed. And I'm like, we got you. Like if there's a need for that, we have those referrals for you. And it's just this really smooth, beautiful journey where they're not having to, go on Google at 2 a.m. And if they're comfortable and they're open to it, we get to work with other providers so that they can have that continuous care. If they're treating with a pelvic floor therapist or they're getting support from an IBCLC, but we're providing postpartum care, we then get the information of like, okay, what's the direction? What's the plan? How can we then as postpartum doulas continue to encourage and support that? And
I love that.
it's just it's such a feel good, and it makes this work a little less lonely as a provider.
Oh my gosh. I think, when I first started Bellflower, because I'm so used to working like in pediatric offices with like a team of people. And I was like so proud of what I was building, but I was also just like, it's really lonely out here. And so now that I'm further on in the practice, like the collaboration is so exciting to me, and the ability to get to know like awesome doulas like you and lactation counselors to be like, yes, you guys are the critical people to get things started. And then I'm over here when things get a little more complicated. And then guess what? There's people over there when things get more complicated outside of my skill set. And I think that collaboration and that referral network gets patients the best care. I'm very much, and I think years of clinical practice got me to this point of being very comfortable being like, I don't know, but let's get you to the person who does, right? Exactly. Or that's outside of my skill set, but I know somebody who's really good at that. Yeah. I'm not, I'm not trying to be a one-stop shop for everything for families. In fact, I don't even necessarily think that that's going to get them the best care, but I sure as heck will love to collaborate with other awesome providers in this community. And we're really spoiled. We have a lot of fabulous folks in this community to collaborate with, and that is exciting. And it keeps work so much more rewarding, I think.
Yeah, absolutely. I totally agree. So let's talk about ties. And let's kind of start with the basics, just for those, if they're listening, maybe they have yet to have a baby, maybe they're expecting, or maybe they have not experienced ties. Just kind of explaining what those are and how those can play a role in breastfeeding journeys.
Yeah. So in the introduction, you had mentioned like tethered oral tissues, right? But more commonly, we call it a tongue tie or a lip tie. And my journey into this work has again been very humbling. Yeah. I very much was somebody who was sort of like, those don't exist back in my pediatric days, right? Like that's just made up. There's no evidence for that. That's garbage. And then honestly, it took me really only focusing on lactation. So just, all day, every day, getting in babies' mouths, seeing what was going on at the breast, seeing what was happening in terms of the function of the tongue, the palate, so the roof of the mouth, et cetera. Yeah. And then it was another humbling moment of being like, oh, I was wrong, right? They really are a thing. And they really do influence a lot of feeding, all aspects of it, truthfully. So what's really interesting to me now is looking at what is the actual function of baby's mouth. And that's in the end, the most important part when we start to talk about things like tongue ties or lip tie. It's not how does the anatomy look, but it's what's the function of the anatomy. And I will tell you, I have seen babies who look like they should be, they have what we would consider as like a terrible tongue tie, the way it looks, right? But functionally, they're actually doing really well, which is always a surprise, when you see this. And those are the scenarios where we wouldn't necessarily recommend going and having a procedure. We might do some other oral motor work, potentially some function. Yeah, exactly. But really, it may not necessitate like a big procedure. Right. And then there are other times where it might not look like a whole heck of a lot, but the function is so poor and the whole feeding picture is so intense, hyper dysfunctional that it really necessitates us doing something. And that typically, in most scenarios, it does not mean that we identify it, or as a nurse practitioner, I have the ability to actually diagnose it, right? And then that we just go and say, oh, get it fixed tomorrow, right? That's not the typical path because we know the outcome is not often all that great with that fast of an approach. So typically,
just that in itself is not.
Exactly. Yes. So like the typical path might be a family comes to me, they've had a really difficult feeding journey. They may have said, I've seen other people, they've said the latch looks good, but I've had persistent nipple damage. Every time I feed my baby, I'm cringing in pain. I've started to not want to put baby to breast. It's really become sort of an aversion for me, or I dread doing it. I hear that a lot.
Yes.
Or I've been relying on a nipple shield since the get-go. I've had a lot. Or, breastfeeding just never worked for us, but now my baby's super gassy and they're having a lot of reflux issues, maybe some weight gain issues, although not always, milk supply issues, et cetera. I mean, it's typically multifactorial. And then, it requires a couple of things. One is like a good oral assessment. So actually getting in the baby's mouth if baby is willing and feeling and looking and trying to sort of identify anatomically what's going on. But then also if I'm able to really feel baby suck on my finger and then see what is their tongue actually doing. What does the roof of the mouth feel like? But then also what's actually happening when we're feeding. So whether it's on the breast or the bottle, what does that look like, right? Because sometimes, like I said, I'll get in a baby's mouth and I was like, oh gosh, this is going to look terrible on the breast. And then I see him on the breast, I go, well, okay, mom's not having any pain. Baby's actually transferring milk really well. So then, the approach is going to be different. So again, super individualized. So then we kind of figure out with the family what feels like the best plan for you. What do I recommend? What does the family feel is manageable?
Hey guys, it's Stephanie Sinclair, founder and owner of How To Mom. I'm just interrupting today's episode to make sure you are well aware of all that How To Mom offers. We, of course, are a community and a support group for all moms at all stages of life, but we also offer a large variety of services that I wanted to make sure you are well aware of. We offer birth doula services, both in person or online support. We have birth support groups with different birth packages to choose from. We also provide placenta encapsulation services, lactation services from our lactation counselors. We also offer postpartum services, birth planning assistance, belly casting. We have a registered dietitian, nutritionist. We also offer a variety of photography services from birth, newborn, and family packages. We truly have it all here at How To Mom. So please don't hesitate to reach out today to have a free consult and help us find the best way to support you in your pregnancy, birth, and postpartum journey. Now back to today's episode.
I'm super excited to be sharing an office with Maria at Happy and Healthy Therapy because she's an occupational therapist. She does feeding therapy and craniosacral therapy. So she really, again, like I can't do it all, right? I'm not even interested in doing it all. So being able to collaborate on patients that might need that extra care has been incredible. So sometimes we'll have patients kind of work with both of us, or sometimes they'll hop over to her for a while just to get ready for a procedure if that's what's on the table for this family. And then depending on, right, what that individual family needs, whether it's a release with a provider or something different, then typically they'll follow up with me again, usually 2 to 3 times, depending on how things are going. And sometimes, in those cases where it's really, hey, we don't need a release, we've made really good progress working on oral motor function or easing tension in the body or doing some little tweaks, like you said, right, at the breast or on the bottle, can make all the difference. I have done a fair amount of training and sort of like in oral motor function, but then also in just like bottles, which is not something, right?
Right.
But so I just had a family the other week and they just weren't using a great bottle.
Right.
We switched the bottle and now it didn't necessarily change everything that was going on,
Right.
but all of a sudden feeding became much more manageable for this family.
Yeah.
And that's like such an easy switch, like you were saying, like a little positioning tweak, and all of a sudden things get so much better. So,
Yeah.
but it's just been this whole tongue tie or tethered oral tissues world has been super humbling for me.
Yeah.
Um,
And I think it goes a lot. And I think it can be really helpful to meet with you prenatally too, and just any lactation professional who can really provide education of like, how does feeding work? I think before I kind of entered this world, we just think, okay, a baby latches, sucks, and swallows, and not really understanding even how does the tongue even have a part of feeding, and that the tongue is actually transferring the milk, which, and I think too, to go back to just this idea of like, are they even real? I think what I'm always trying to relate, and I think of like my mom's generation, and that's a big generation. I think that's like, that's not a thing. That was never a thing when we were feeding. But then we continue to ask questions in a very non-judgmental way of how did breastfeeding go for you? Were your friends breastfeeding? No, I just didn't have a good supply, or no, my baby wasn't interested. And then we kind of start to dig and wonder, well, I wonder why, what were the reasons behind that? And so I think it is just really humbling, for somebody from that generation to say, oh, that's not real. And then to say, how was breastfeeding successful for you and your friends and your family members? No. Did you ever think that maybe why is because we weren't diagnosing it, and maybe it wasn't your supply, but your baby wasn't able to stimulate your supply because they weren't able to transfer, right? Knowing that supply and demand theory. And I just think the education is like, it's just one of those things, like once you really dig deep and you have the right professionals in your corner to explain that to you, it does all make sense.
Yeah. No, I mean, it's fascinating because even me, like digging into this world, and like I've just gone down this rabbit hole in a good sense, not in a crazy sense, right? But in really learning, how does the mouth work? Because I didn't really learn that in nurse practitioner school. I didn't learn that becoming an IBCLC. That's all additional training and courses, etc. But really starting to understand that, because then what we're looking at, particularly with breastfeeding, is the matching up of the puzzle pieces. What's the roof of the baby's mouth like? What's the tongue like? What's mom's breast tissue, nipple, etc. like?
Yes.
And you could have the perfect breast, but a challenging mouth. You could have a challenging breast and the perfect mouth. But if they don't, if the puzzle pieces don't fit together, we need extra help, right? Yes. So there certainly are plenty of people where that all works really well, and that's wonderful. That's how we'd like this to go. But there are lots and lots of babies who have very high palates or small, narrow jaws, right? Or other, or moms who have flat nipples, et cetera. And that just makes it all a little bit more challenging. Not to say, right, we are all sort of, I believe our babies are destined for us, and like we can still find ways to make that work. But there are sometimes some real challenges within that. And knowing how the tongue functions in the mouth, and what the breastfeeding is an incredibly complicated process.
Very.
And there's another, I'm going to butcher who it is, but there's another IBCLC out there who's escaping me. And her whole thing is breastfeeding is the first vital sign. And I love that so much, because if we aren't able to successfully breastfeed, something's going on.
Yes.
Right?
Yes.
And so that is something that I wish very much we could get other providers to embrace.
Yeah.
And I'm actually really excited. I just went to this conference in February, and there was Dr. Agarwal, who's a pediatrician from Arizona. He has come out with this flip tool, and it's actually a breastfeeding assessment tool, but it's to be used like in pediatric offices and dentist offices and kind of anywhere, OB offices, et cetera, just to assess how is breastfeeding going? Like nothing related to tongue ties, nothing else, but just
Yeah.
how is breastfeeding going? And if you score, high enough, right,
Yeah.
that should necessitate a referral to an IBCLC. And I think
Yes.
it's such a simple tool because we don't really have anything like that right now.
Right.
And all too often in pediatric offices, you get providers like how I was, how's feeding going? Great. Okay, moving on. Or, well, baby's gaining weight really well, so no problem.
Right.
But it's not looking at the whole bigger picture.
That missed referral and that missed report or that missed support. And I say that really often. First of all, just because breastfeeding is a natural process doesn't mean that it's going to feel natural, and that is okay. Both you and your baby are learning at the same time. But also, I'm a big believer that if you wish to breastfeed, if breastfeeding is a top priority for you, the right support is what's vital. And I truly believe that. That doesn't mean that it's an easy journey. That doesn't mean that there aren't hurdles. But if that is something that is truly important to you, you deserve to get the support to kind of get on that other side so that you can have this successful breastfeeding journey. I did not exclusively breastfeed Brinley until she was 12 weeks old. I mean, it was a journey. It was a process. But what I had on my side was I knew what my values and what aligned with me and what I wanted that to look like. And that's going to look different for everybody. And that's okay. And that's amazing. But I also had the support. I had my IBCLC. I had providers that could help and assist with her tongue tie. And it was a challenging time, but because of the support that I received and that I had in my corner and that I deserved, I was able to exclusively breastfeed her for a year, and that was really important to me. And that's what I want. There's so much that I want all of our listeners to take away today. I think we could talk forever, and I would love to have Amelia back on to even dig deeper into more specifics. For example, nipple shields. Could do a whole episode on nipple shields.
Yeah.
But two things that I want you guys to take away, the listeners today, is one, in terms of tongue ties, oral ties, that we just kind of briefly talked about, is if somebody has maybe mentioned or you have a intuition that that is happening, I strongly urge you to make that appointment with an IBCLC before kind of taking any other routes. Not only because even if a revision is a necessity, you will go into that with confidence and feeling empowered because you have support surrounding you and understanding why it's a necessity. But then also the care after that is so vital and important, not only kind of just logistically that tissue can grow back together if we don't get the support that our baby needs, but also there's so much more that comes along with that. And that can just be body mechanics of our babies, but that also can be maybe something happened during birth or their position in utero. Like there's so many factors, and you deserve to have the support and the follow-up care so that you don't feel like, okay, I've just done all this and it's still not going well. Well, are you surrounded by support? Are you surrounded by care by the professionals who are not only trained, but continue education with evidence surrounding ties or any other kind of lactation issues that you may be experiencing? So I could go on and on. Amelia, if you could leave our listeners with one piece of advice, which I think our intro really kind of spoke to that, as well as your brand and the meaning behind the Bellflower. But if there's one thing that you could leave our listeners with today, maybe a mom who had a really tough journey or she's on a really tough breastfeeding journey, and it doesn't even have to be like specific to breastfeeding, but just a piece of advice of letting them know that they are loved, they are cared for, and support is available. What does that look like? And what would you want them to remember as they hang up listening today?
You know what I think a lot about? I think, I have 3 girls. How the support and the compassion I hope my girls have when and if they become mothers. I think we are so willing and able to think about all the things we want to give our kids,
Mhm.
but not give it back to ourselves. And I remind myself a lot of that if I think my children deserve a certain support or love or understanding or grace, right? That we as moms or as parents deserve the same thing right back on us. And if we take it, we're role modeling for our kids.
Yes.
And they need to learn to do that in their lives. And to me, I think that's just, I'm still like working on that.
Yes.
Yes,
A constant journey.
Yeah, it sure is. But I think for a new mom, that if you could embrace that, what an amazing thing you'll give yourself and you'll give your own children.
Yeah, I love that. And kind of to speak to that, because I was talking to a friend yesterday, and, you know, we all are kind of our own worst critics, right? What we say to ourselves. And she was going through a hard time. And I looked at her and I said, all of those things that you just said to yourself, if roles were reversed, would you say those things to me as your best friend? And she was like, I would never. And I'm like, why are you telling yourself then that then? So if you are in a position where you might be beating yourself up, or you're not feeling like you're enough, or you have regret, if you were to sit down with your best friend or a loved one or somebody who means so much to you, and they were going through that same thing, would you speak those words to them? Or would you tell them that they're loved and they're worthy, and that they're being too hard on themselves? Then don't say it to yourself. You deserve it. So, well, will you let everybody know how they can get in touch with you, how they can schedule any of your services? We will have all of the links in our show notes below as well, but just let everybody know, how can they get in touch with you? Because you are such an incredible provider. I feel so lucky that not only my clients have you available to them, but that you're here in the Twin Cities and available to a lot of families. And then maybe even, you know, if you're listening and you're not in Minnesota, to be able to even set up a virtual prenatal with Amelia as well.
Yeah, absolutely. Okay, so to get in touch with me, probably the easiest thing is to text me, and that number is on my website. Or certainly shoot me an email. I always tell parents they're welcome to call, but as a busy mom of 3 running my own practice, right, that's typically I can reply to a text before I can get back to a phone call. People also can just book directly through my website if they want. I don't have home visits available to book directly through the website, just because that's a lot more schedule dependent. So sometimes that confuses people, but certainly text, email, or direct booking is great. But if people feel a phone call is most helpful to them, they certainly can call and just leave a voicemail, and I'll return the phone call for sure.
Awesome. Well, thank you again for being on today, for all of your wisdom and all the support that you give families. I hope you know that you definitely are having a huge impact on not only their breastfeeding journey, but also just their motherhood journey as well. So thank you for all that you do.
Thank you. I'm so grateful for all that you do as well. So thank you so much.
Thank you. Thank you so much to all of our listeners for listening today, and let us know if you have any questions or any topics that you would like Amelia to come back on the podcast and answer for you. So have a great day. All right, you guys, that is it for today's episode. I hope you enjoyed. If so, please subscribe to our podcast, comment, share, give us feedback. We'd love to hear from you. Thank you so much for taking time out of your day to listen, and we will see you next time.